This Health Minute is brought to you by St. Francis Health. We listen, we heal.
Welcome back, where we are learning more about melatonin. Turns out it may help with more than just sleep. Mandy Gaither explains.
In older adults, it's the most common cause of severe loss of eyesight. Age-related macular degeneration, or AMD, blurs your central vision.
It's one of the most devastating conditions, up there with a diagnosis of cancer or even a heart attack. Losing your sight and losing your central vision really is imperative to many patients, and keeping their overall mental status stable.
Ophthalmologist Dr. Rishi Singh with Cleveland Clinic says right now antioxidant vitamins are mostly used to prevent AMD, but it doesn't always stop the progression of the disease. So he and other researchers started studying the potential benefits of a supplement commonly used to improve sleep.
We've learned that melatonin obviously has some really potent antioxidant effects and also has some benefits in regards to pigment within the retina.
The study followed more than 121,000 patients ages 50 and above with no history of AMD and found taking melatonin was linked to a reduced risk of developing the eye disease. And in more than 66,000 patients who already had a slow progressing form of AMD, the study found melatonin takers were less likely to progress to severe stages of the disease when compared to those who didn't take the supplement. While more clinical research needs to be done, Singh says patients at increased risk of AMD should talk to a doctor.
This is a very valuable, I think, conversation to have with your eye doctor to determine if it's right for you.
For Health Minute, I'm Mandy Gaither.